I've been dealing with some nerve discomfort. The back of my right elbow goes all the way to the back of my hand.
Right elbow or left? Or are you flip-flopped? Okay, yep.
Go to the back of my hand. Sometimes
Right elbow to the back of
the
your hand.
scapula.
Okay.
And I am trying to resolve it. I think it's some compression I have going on. So it bothers me when I do overhead presses, any kind of presses for that matter.
Okay.
Now it gets better if I do exercises like some bear reach, kettlebells pulled over. And I'm assuming that when I expand my front chest, like my front right chest wall, it helps because then that almost goes away, but it always comes back.
Okay. So we can look at anatomically what's potentially going on, right? And so what I want to do is I want to walk you through this to see if you can figure it out, right? So the nerve that runs from along like here-ish to the back of the hand is the radial nerve.
Yeah.
And the way you would create maximal tension or elongation of the radial nerve, there's a test called the radial nerve neurodynamic test. But basically the position is you flex the wrist, you drive IR and pronation, and then you're moving into progressive abduction, right? So that would be a way you would have maximal excursion of that, right? So now if we look at what rotation is occurring when that's happening, so if I'm driving wrist flexion, I'm pronating, I'm internally rotating, and I'm abducting, from an expansion standpoint and a rotation standpoint, what do you think you need?
I need chest wall.
Mm-hmm. Yeah, because that's an IR-based move.
Uh-huh.
And in order for you to get internal rotation, you would need to be able to expand anteriorly.
Yeah, and I've been thinking of that because I know that I'm like most people.
Mm-hmm.
I have that torque, and I know I'm compressed, and my right shoulder kind of falls down. And so I've been trying to figure out what to do.
Okay. Well, let's reverse engineer this. All right. So here's what we know you need based on, in order to get full motion through there, so that's not overloaded. You need to be able to drive internal rotation, and that could be either at the forearm, because I need to be able to pronate. That could be at the shoulder, because I need internal rotation. That could be at the chest wall, so we know you might need pump handle. But then superimpose underneath that what infrasternal angle presentation would also be correlated with those particular restrictions.
Well, what I am narrow.
You are, yes. It's kind of like we should have an infrasternal angle anonymous group. Hi, my name is Camilla and Zach, and I'm a narrow infrasternal angle. Me too. So now if we look at all of those pieces, we could see how we have to differentiate because these particular limitations, assuming that you have that, would be based on or normal, right, for your structure, that you would be predisposed to being limited in internal rotation-based things. So the steps you would have to look at is, well, can you stack? Because the stack is going to help you be dynamic through the ISA. So that's step one. Step two is, okay, if you have that, do you now have, well, that might actually be able to clear up some of the anterior expansion limitations. And then if not, do we have the ability to internally rotate throughout the extremity to get there?
Yeah, you know I can't stack, because otherwise I wouldn't be talking to you right now.
So what kind of moves are you attempting to utilize to make that happen?
To get my expansion.
Mm-hmm.
So one of the things I feel is if I am in quadruped, like bear position, I will have my right hand open, reaching, and I have a fist on my left.
Okay.
That would get me a lot of posterior left and some anterior right.
Yes.
I can do the same thing in standing, like in a kind of squatty squat position where I'm reaching through my right hand and I'm holding my left elbow to get, again, some posterior left, anterior right. One of the things that I really love doing that usually feels good and it fixes my problem for a while, I would lay down on the bench with my pelvis a little higher than the shoulder, so I'm declined. I'm having a kettlebell and I'm doing a slow pullover. And with that, a good inhalation really gets me to open up the front wall.
Nice.
So
That's
usually
awesome.
what I do, I would do that for reps, and then I go do my presses, and my discomfort is very minimal.
All of those should indicate then that you restoring some type of internal rotation is helpful.
Yeah.
Because all of those, your ability to go overhead, you doing single arm reaches, or like the quadruped modified, is all going to create anterior expansion on that side, right? So I think the name of the game, or the concepts that you would need then, would be anything that's reaching forward. You could bias that even further by making some of those moves a bit more rotational. So your quadruped, if you just simply lifted your hand up and had like a low reach position, so I'm at this angle here with the elbow flexed, that's going to drive more rotation through the thorax, which is then going to help you get even more IR on that side that's affected. And then if you do that and you drive things where you're creating some pronation with elbow extension, so think like local tricep work, that would likely also help. And then the last thing I would say for you, Camilla, is if you've done that, you got all of your movement options available, you could still have some sensitivity in the nerve. And there's different, and it may be the case that you need to create some actual motion in the nerve itself, because nerves need three things to be healthy. They need movement, they need space, and they need blood flow. Increasing the range of motion at all the joints will create space, but you might actually have to create some local movement. And so there's a move that you can do called like a radial slider, where basically what you would do is, hopefully you can see me, but I'm going to flex the wrist back like this and into extension, and then I'm going to take my head and tip it back and look at it. And then I'm going to go up this way. But I can also, I'll link it in the show notes to be able to see it. But I think if you did those moves and you drove the pronation, internal rotation, stuff like that, this would probably clean up. At least that's my hope. And it sounds like it is getting better. You just might need to drive even more end ranges of it.
Yeah. Yeah. I mean, it gets better if I pay attention to it. Then it's, I don't know, that I think it's some pattern. Right, I am very right pattern, as you remember. I don't know if you do remember, but I am definitely into that right pattern. So I can't clean it up for good. It just goes away, gets better, but then it comes back.
Yeah. Well, and you just may have to progress to doing a lot more things where you are rotating yourself left, because the more you rotate left, the more IR is gonna improve on the right side. If you do that, no one will mess with you.
I
All
will.
right.